Ever been woken up in the middle of the night by an excruciating leg cramp? That's a Charley horse for you. This sudden, painful and involuntary muscle spasm is a phenomenon that many of us have experienced. Predominantly affecting the leg, especially the calf, a Charley horse can strike at any time, whether you're deep in slumber or in the midst of a vigorous workout. What makes it particularly unpleasant is its unpredictability. One moment, you're peacefully dreaming or pushing through that last set of squats, and the next, you're crippled by a searing pain that takes your breath away. This muscle contraction can last anywhere from a few fleeting seconds to several long, agonizing minutes. And trust me, when you're in the throes of a Charley horse, even a few seconds can feel like an eternity. While the spasm can last from a few seconds to several minutes, the pain and tightness in the muscle can be quite intense. So what triggers these agonizing Charley horses? Let's delve into the causes. First off, one of the most common causes is muscle overuse or injury. This is particularly common amongst athletes or those who engage in strenuous physical activities. Pushing your muscles too hard, too quickly can lead to these painful cramps. So remember, moderation is key. Secondly, dehydration is a major culprit. When your body is not adequately hydrated, it can lead to an imbalance in electrolytes. Electrolytes are minerals that help your muscles function properly. Without enough water, your muscles may cramp up, causing a Charley horse. Speaking of electrolytes, low levels of certain ones, particularly potassium and calcium, can also trigger Charley horses. These minerals are crucial for muscle function and nerve communication. When levels dip, it can disrupt the balance, leading to muscle spasms. Moving on, nerve issues can also be a cause. Your nerves control your muscle contractions, so any disruption in nerve function can lead to muscle cramps. This could be due to a variety of reasons, from an underlying neurological condition to simple nerve compression from prolonged sitting. Then there's stress. Yes, even your emotional state can influence the likelihood of experiencing a Charley horse. Stress can tense up your muscles, making them more susceptible to cramping. Lastly, certain medical conditions can increase the risk of Charley horses. These include kidney disease, thyroid disorders, and certain metabolic disorders. These conditions can interfere with your body's balance of electrolytes and other important substances, leading to muscle cramps. Certain groups are more susceptible to Charley horses, including athletes, older adults, overweight individuals, pregnant women, and those on dialysis. Scene script. Experiencing a Charley horse can be quite distressing, but how do you treat it? Now let's dive into the treatment options for these pesky muscle spasms. The first and perhaps the most immediate way to alleviate a Charley horse is by stretching. Stretching the affected muscle can help release the tension and relax the muscle. For instance, if you're experiencing a Charley horse in your calf, try standing about 2 feet away from a wall and lean into it, keeping your heels on the ground. This should stretch out your calf muscles and help relieve the pain. Another effective method is massaging the cramp muscle. Gentle circular motions can help soothe the muscle and ease the pain. A muscle cramp is essentially a muscle in overdrive, and massaging it can help bring it back to a relaxed state. Applying heat or cold to the affected area can also be beneficial. A warm towel or a heating pad can help increase blood flow to the area and relax the muscle. On the other hand, icing the area can help reduce inflammation and numb the pain. If the pain is severe, over-the-counter non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen can help reduce the pain and inflammation. Remember though, these should be used sparingly and only when necessary. Now let's talk about hydration and diet. Dehydration and low levels of certain minerals can cause muscle cramps. So, rehydrating with water or a sports drink can help replace lost fluids and electrolytes. Consuming foods rich in potassium, such as bananas, oranges, and sweet potatoes, can also help prevent muscle cramps. Remember, these are only immediate remedies. If Charley horses persist, it's crucial to seek medical advice. Prevention is always better than cure. So how can we prevent these painful muscle spasms? The key to preventing Charley horses lies in maintaining overall health and fitness. Let's delve into the many ways we can keep these unwelcome muscle spasms at bay. Hydration is the first on our list. Water plays a critical role in muscle contraction and relaxation. When your body lacks adequate hydration, it can lead to muscle cramping or Charley horses. So make sure you're drinking plenty of water, particularly before, during and after exercise. Next, let's talk about diet. Certain minerals such as potassium and calcium are essential for proper muscle function. A deficiency in these can trigger muscle spasms. Consuming a balanced diet rich in fruits, vegetables, dairy products and lean proteins can help maintain adequate levels of these vital minerals. Stretching is another effective preventative measure. Regular stretching exercises increase flexibility and reduce muscle tension, thereby reducing the risk of muscle spasms. Whether you're an athlete or someone with a sedentary lifestyle, incorporating stretching into your daily routine can be beneficial. Adjusting the intensity of your exercise can also help. Overuse or sudden strain on your muscles can lead to Charley horses. It's therefore crucial to gradually increase the intensity of your workouts and to always warm up before and cool down after exercise. Lastly, treating underlying medical conditions is pivotal. Certain ailments, such as nerve disorders or kidney disease, can increase the chances of experiencing Charley horses. Regular checkups and proper management of these conditions can go a long way in preventing muscle spasms. Remember, prevention isn't about a single action, but rather an amalgamation of healthy habits. It's about drinking enough water, eating a balanced diet, stretching regularly, exercising wisely, and staying on top of your overall health. Preventing Charley horses primarily involves maintaining good overall health and fitness. While a Charley horse can be a common occurrence, there are instances when it's necessary to consult a healthcare provider. Charley horses, those sudden painful spasms or cramps that can jolt you awake in the middle of the night, can be quite benign. They may occur if you've overexerted yourself during a workout or if you're dehydrated. However, these muscle cramps can also be a sign of an underlying issue that requires medical attention. It's important to listen to your body. If you're experiencing Charley horses more frequently than you used to, it might be more than just an overworked muscle or a lack of hydration. Frequent muscle cramps could be a symptom of an imbalance in your electrolytes, such as potassium and calcium, which are vital for muscle function. In such cases, a simple blood test can help identify any deficiencies. Similarly, if your Charley horses are accompanied by other symptoms, such as numbness or tingling, it could indicate a nerve issue. Conditions such as peripheral artery disease or spinal stenosis can cause these symptoms. A visit to your healthcare provider can help rule out these conditions. Also, persistent Charley horses that don't seem to respond to typical treatments such as stretching, massaging, or consuming potassium-rich foods should be a cause for concern. If you've tried these interventions and the cramps continue unabated, it's time to seek professional advice. Certain populations, including older adults, overweight individuals, pregnant women and those on dialysis, are more susceptible to Charley horses. If you fall into these categories, it's especially important to keep an eye on the frequency and severity of your cramps. Remember, frequent Charley horses can be a sign of a more serious condition. Don't ignore them. Seek medical advice. The value of your health cannot be overstated. If Charley horses persist, don't hesitate to consult a healthcare provider. They can guide you to the appropriate treatment and help you get back on your feet in no time. Now let's answer some common questions about Charley horses. First off, many wonder, why is it called a Charley horse? The term dates back to the 19th century and its origin is a bit of a mystery, though it's often associated with sports and athletics. Next, can Charley horses be dangerous? Generally, they're harmless, but frequent episodes might indicate an underlying issue such as a nerve disorder or mineral deficiency. Thirdly, do Charley horses occur more frequently at night? Indeed, they can, especially when your leg muscles are relaxed during sleep. And lastly, can diet influence the frequency of Charley horses? Absolutely. A diet rich in electrolytes, particularly potassium and calcium, can reduce the likelihood of these spasms. Understanding Charley horses can help you better manage and prevent them. Stay informed and take care of your health.